Guys, welcome back. We'll be going to the next topic, that is ulnar nerve. Okay, see, again, I'm telling you the three nerves are very, very important: radial nerve, median nerve, and ulnar nerve are very, very important. Okay, so we'll go to the ulnar nerve. So, before going into the ulnar nerve, again, we'll just trace the ulnar nerve from where it is arising, where it is crossing, what are the problems it can encounter. So, all those things we'll do. So, to just make you enlighten, I'll just draw again a simple diagram to understand the course of the ulna. Okay, so as you all know that the humerus has got the head, the greater tubercle, the shaft of the humerus. Okay, and this is the lesser tubercle of the humerus, and this is the lateral condyle of the humerus. This is the capitulum of the distal humerus. This is the trochlea of the distal humerus, and this is the medial epicondyle of the distal humerus. So, in this bone, the most important structure which we need to understand is this one. Okay, so I'll just mark this part. This part is the medial condyle of the humerus. This is called as the medial condyle of the humerus. Okay, so this you must understand. So, this is medial condyle of the humerus. I am not telling you the other parts here. I don't want you to remember other parts for the ulnar nerve here, but you should know that there is a bony prominence on the medial side, that is called as the medial condyle of the humerus. Now, when you trace the elbow, here you can see the capitulum articulates with the head of the radius, neck of the radius, and you get the shaft of the radius, and you get the shaft of the radius. Okay, you get the shaft of the radius, and you get the ulna, which is articulating with the trochlea, and you can see the ulnar shaft, which is narrowing down below. Okay, so you get a joint there that is called as distal radioulnar joint. So, at this junction you need to know about this medial condyle of the humerus, and we also know that medial condyle of the humerus is the main originator, or it is the area where the flexor muscles takes their origin. It is a common flexor origin. So, this medial condyle is called as the common flexor origin, and I hope you also know among the flexor muscles, the most medial muscle, or which is close towards the ulna, is the flexor carpi ulnaris muscle. It is flexor carpi ulnaris muscle, guys. Yes, we saw that pronator teres muscle related to median nerve. How many heads it has got? Can anybody tell me how many heads the pronator teres has got? Yes, guys. Yes, pronator teres, how many heads it has got? It has got 2 heads, isn't it or not? So, pronator teres has got 2 heads. One is called as the humeral head, another one is called as the ulnar head. Between those 2 heads runs the median nerve. Very similarly, here you get a muscle called as flexor carpi ulnaris muscle. So, you get a muscle here which is called as flexor carpi ulnaris muscle. So, what is this muscle? This muscle is called as the flexor carpi ulnaris muscle. So, this muscle which I am drawing here is the flexor carpi ulnaris muscle. Again, it has got 2 heads, guys. There are 2 heads for flexor carpi ulnaris, and these 2 heads are, one is again the humeral head, and the next one is called as the ulnar head. Okay, next one is the ulnar head. Now, when it comes to the wrist, so you should know about this muscle here. So, you should know about this muscle. So, this is called as the flexor carpi ulnaris, and you also know that in the axillary region, you can see the axillary artery continuing as the brachial artery, and this brachial artery, when it reaches the neck of the radius, it splits into 2. One is called as a radial artery, another one is called as an ulnar artery. I hope you know that ulnar artery is running along the medial aspect of the forearm. You can see the ulnar artery which is running here. So, you should know about this artery. We will discuss about this artery in detail when we come to the arteries of the upper and lower arteries of the upper limb. So, here there is an artery which is running on the medial aspect of the forearm, that is ulnar artery. Now, when it comes to the wrist, I hope you all know that in the wrist you have got carpal bones, you have got scaphoid, lunate, and the tricuteral bone. What are the proximal row of carpal bones? So, you know that there is scaphoid, there is lunate and tricuteral, and sitting over the tricuteral is the pisiform bone. What are the distal row of carpal bones? Trapezium, trapezoid, okay, capitate and hamate. Okay, you know that there are carpal bones in the wrist. That is more than enough at this junction. And you also know that there is a retinaculum which is here. Can anybody tell me what is the retinaculum which is bridging the carpal bone? Yes, yes guys. So what is the retinaculum which is bridging the carpal bones? What is the name of the retinaculum here? Anybody? Yes, Mugundan, Adira, yes, Hari, anybody? So what is the retinaculum which is seen here? Yes, it is flexor retinaculum. Very good. Yes, it is flexor retinaculum. Very good guys. See, can anybody tell me flexor retinaculum is a modification of flexor retinaculum? We have discussed about flexor retinaculum, but I didn't told about this point. Can anybody tell me flexor retinaculum is a modification of what structure? Modification of what tissue in the forearm? Can anybody tell me? See, this flexor retinaculum, okay, this flexor retinaculum, okay, is a modification of deep fascia of the wrist region. Deep fascia, it is a modification of the deep fascia. Okay, in a very similar way, you got a retinaculum here that is called as the extensor retinaculum. That is also is a modification of deep fascia. Okay, so you know that there is a retinaculum in the wrist which is called as the flexor retinaculum. Now if you trace the ulnar nerve, you should know these areas guys. You should know these areas because tracing the ulnar nerve is very much related to these areas. So you also know that there is a cord on the lateral cord of brachial plexus. Okay, this is the lateral cord. This is posterior to the axillary artery. That is a posterior cord, and this is the medial cord of the brachial plexus. We have discussed about the medial cord of brachial plexus, and can anybody tell me the important branch from the medial cord of brachial plexus? I gave you a simple mnemonic: more money makes men unhappy. What is it? U stands for? U stands for ulnar nerve. U stands for ulnar nerve guys. Okay, so from the medial cord of brachial plexus, the ulnar nerve arises. So let us consider this is the medial cord of brachial plexus. This is the medial cord of brachial plexus. This is the medial cord of brachial plexus, and the important nerve which arises from the medial cord of brachial plexus is the ulnar nerve. Okay, so when the ulnar nerve runs in the arm region, approximately at the middle of the arm, I told you lot of changes happens in the middle of the arm. At the point where the coracobrachialis gets inserted, lot of changes happens. One changes I have already told you. Can anybody tell me what is the change that happens at the middle of the forearm? The median nerve from the lateral side goes to the medial side, isn't it or not? In a very similar way, at the middle of the arm, so there is a retinaculum here. Okay, this retinaculum is called as the, or this septum is called as the medial intermuscular septum. So what is this septum? This septum is called as the medial intermuscular septum. Medial intermuscular septum. Okay, medial intermuscular septum, and the ulnar nerve pierces the medial intermuscular septum and becomes posterior structure. It runs now on the posterior aspect, on the extensor aspect of the arm. So this is the flexor aspect and this is the extensor aspect. Initially the nerve was running on the flexor aspect. It pierces the intermuscular septum and becomes a posterior structure, and now when it runs in the arm, when it reaches the elbow, it runs behind this bone. What is this bone called? This bone is called as the medial condyle of the humerus. It is running behind the medial condyle of the humerus. So please remember guys, ulnar nerve is very much close in relationship with the medial condyle of the humerus. So suppose if somebody asks you, there is a fracture of the medial condyle of the humerus, what is the nerve that is injured? Blindfoldedly you can answer it is ulnar nerve. It is ulnar nerve. So whenever there is a fracture of the medial condyle of the humerus, the ulnar nerve is one which is injured here. Now when this nerve crosses behind the medial condyle, it is easily palpable. You can palpate your ulnar nerve just behind the medial condyle of the humerus, and when you hit your elbow against a hard surface at this point, you will have a tingling sensation in your forearm. You have felt it. I think everybody would have felt in their life when they hit their elbow against a hard surface, they will have a tingling sensation. So because the nerve is very close to the bone here, it is very superficial here, and it is here where in leprosy you feel for the thickening of the ulnar nerve. In leprosy, thickening of the ulnar nerve is felt behind the medial epicondyle. Now since we have talked about leprosy, can anybody tell me one more nerve in the body which gets thickened in leprosy? Any one more nerve in the body which gets thickened in the leprosy? Anybody guys? Yes, Hari and Kiki, Muga. Yes, anybody? Any one other nerve in the body which gets thickened in leprosy? Okay, so there is, yes, very good. So greater auricular nerve, and there is another nerve around the neck of the fibula, that is common peroneal nerve, gets thickened in leprosy. Okay, in leprosy you get greater auricular nerve, and you get the common peroneal nerve thickened around the respective bones. So you can palpate those thickened nerves. So in leprosy these are the nerves which are thickened. So in leprosy, when the ulnar nerve is thickened, you can feel it behind the medial condyle. So much relationship for the medial condyle of the humerus. Now after it crosses the medial condyle of the humerus, it passes in between the two heads of flexor carpi ulnaris. So what is this muscle? This muscle we have already marked. This is flexor carpi ulnaris muscle. It has got two heads. It runs in between the two heads of flexor carpi ulnaris. Here it forms a tunnel called as cubital tunnel. The flexor carpi ulnaris forms a tunnel called as cubital tunnel. Okay, so please remember guys, for the median nerve the tunnel is carpal tunnel. For the median nerve the tunnel is carpal tunnel, whereas for the ulnar nerve the tunnel is cubital tunnel. So please remember this. For median nerve the tunnel is at the wrist. This is carpal tunnel. For ulnar nerve the tunnel is at the elbow. This is cubital tunnel. So cubital tunnel syndrome, if somebody asks you what is the nerve that is affected in cubital tunnel syndrome, the answer is very simple. It is ulnar nerve. It is ulnar nerve. Okay. Now the nerve, after passing through the cubital tunnel, runs on the medial aspect of the forearm, accompanied by an artery. Now what is this artery? Yes, everyone know this. This artery is ulnar artery. This artery is ulnar artery. Now both the structures reaches the wrist region. Both the structure reaches the wrist region. And how they cross the wrist? They cross superficial. They cross superficial to the flexor retinaculum. They cross superficial to the flexor retinaculum. Okay, so they cross superficial to the flexor retinaculum. Though they cross superficial to the flexor retinaculum, they again pass through a tunnel here. They again pass through a tunnel here. This tunnel is called as the, or this canal is called as the Guyon's canal. So what canal is this? This is called as the Guyon's canal. This canal is called as the Guyon's canal. It is formed below a ligament called as pisio-hamate ligament. It is formed below a ligament called as pisio-hamate ligament. So guys, please remember, ulnar nerve passes through two tunnels, one in the elbow and one in the wrist region. One in the elbow is called as a cubital tunnel, and the one in the wrist on the medial side between the pisiform and the hamate is called as the Guyon's canal. Is called as what? Is called as Guyon's canal. So the nerve can get compressed in these areas. It can get compressed in the cubital tunnel. It can get compressed in the Guyon's canal. So the nerve passes through the Guyon's canal. After it crosses the Guyon's canal, it enters the palm and divides into multiple branches. It divides into superficial branch and deep branch. It divides into superficial branch and deep branch. Now what are all the branches from the ulnar nerve? Okay, so if you'll see branches of the ulnar nerve, okay, so in the arm there are no branches in the arm, so no worry about it, no branches in the arm. Okay, in the forearm, okay, in the forearm it supplies two muscles. So the motor branches in the forearm are two. One is it supplies the flexor carpi ulnaris, you all know that, and it supplies the medial half of flexor digitorum profundus. It supplies the medial half of flexor digitorum profundus. So guys, please be clear in this. We have already discussed about this. Just to highlight the things here, flexor carpi ulnaris muscle. Okay, when the flexor carpi ulnaris muscle acts along with the flexor carpi radialis, it causes flexion of the wrist. When the flexor carpi ulnaris muscle acts along with the extensor carpi ulnaris, which is here. So flexor carpi ulnaris, when it acts along with the extensor carpi ulnaris, it causes adduction of the wrist. So this is called as an adduction. This is called as adduction of the wrist. Okay, it causes adduction of the wrist. So we have seen about flexor carpi ulnaris. More important is flexor digitorum profundus muscle. What is flexor digitorum profundus? We have seen the profundus muscle gets attached to the distal phalanx. It gets attached to the distal phalanx. Now if you want to flex the distal phalanx of your ring finger and distal phalanx of your little finger, the medial half of flexor digitorum profundus has to work. Am I right or not? So when the flexor digitorum profundus works, I can able to flex the medial I can able to flex the flexor tissue. I can able to flex the distal interphalangeal joint of the ring finger, and I can able to flex the distal interphalangeal joint of my little finger. Okay, so when the medial half of flexor tissue profundus works, if it does not work, if ulnar nerve is not working, this cannot happen. This cannot happen. Okay, so these are the main motor branches in the forearm. So there are some sensory branches which are also seen here. One such sensory branch is the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of the ulnar nerve, okay, passes superficial to the flexor retinaculum. Passes superficial to the flexor retinaculum. The next branch is the dorsal cutaneous branch of the ulnar nerve. The next branch is the dorsal cutaneous branch of the ulnar nerve. Okay, so this dorsal cutaneous branch of the ulnar nerve runs on the dorsum of your hand. Palmar cutaneous branch runs on the palmar aspect of your hand. Dorsal cutaneous branch runs on the dorsum of your hand, and it supplies the medial 1.5 fingers on the dorsal side. So if you take the ulnar nerve, both on the palmar aspect and on the dorsal aspect, the medial 1.5 fingers is supplied by ulnar nerve. So please be clear, guys. Ulnar nerve, the entire 1.5 fingers, both on the palmar side and both on the dorsal side, there is a complete supply by the ulnar nerve. Okay, so these are the branches in the forearm in the hand region. So please remember, muscles in the hand are numerous. So the ulnar nerve supplies lot of muscles in the hand. So before going into the supply of the muscles in the hand, we'll just see what are all the muscles in the hand, then we'll go to the supply. Okay, if you want to say the muscles, I divide the muscles as intrinsic muscles of the hand. Intrinsic muscle of the hand are divided into following groups. Okay, so one group is called as the thenar group. One group is called as the thenar group. The next group is called as the hypothenar group. Okay, the next group is called as the lumbricals. The next one is the palmar interosseae, and the last one is the dorsal interosseae. Okay, we'll see about these muscles, and then we'll go to the supply of the ulnar nerve, so that it will be easy for you to understand. See, in the thenar group, you have got 4 muscles, guys. One is called as abductor pollicis brevis. Okay, next is called as flexor pollicis brevis. It has got 2 heads. One is called as the superficial head. Another one is called as the deep head. The next one is called as the opponens pollicis. And the last muscle in this area is adductor pollicis. Guys, I hope you remember, we have discussed these muscles in the median nerve itself. We saw a mnemonic called as LOAF. L stands for lumbricals, O stands for opponens pollicis, A stands for abductor pollicis brevis, and F stands for the superficial head of flexor pollicis brevis. We have seen this mnemonic. So these are the thenar group of muscle, guys. So this thenar group of muscles are all supplied by the median nerve. So they are supplied by median nerve. Except this adductor pollicis, which is supplied by the deep branch of ulnar nerve. Adductor pollicis is supplied by deep branch of ulnar nerve. Okay, so coming to adductor pollicis, can anybody tell me what is this action? So this action is called as abduction. Okay, clear? This action is called as abduction. Okay, this action is called as adduction of the thumb. Okay, when I take my thumb towards the surface or towards the palm, this is called as adduction of the thumb. If I want to adduct my thumb, the main muscle for that is adductor pollicis muscle. Very important muscle. Okay, that is a one important muscle for adductor pollicis. There is another muscle which is very primitive, or sometimes it may not be present also. That is the first palmar interosseae. Mostly adductor pollicis is needed for the adduction of the thumb. Okay, so adductor pollicis is supplied by what? It is supplied by deep branch of ulnar nerve. Now coming to the hypothenar group. In the hypothenar group, you have got the following muscles. One is called as palmaris brevis. Next one is called as an abductor digiti minimi. Okay. Next one is called as an flexor digiti minimi. The last one is called as an opponens digiti minimi. This is called as opponens digiti minimi. So you got 4 muscles in the hypothenar region again. So if you take the 4 muscles, if I take my little finger, this is called as digiti minimi. If I want to do abduction, this is called as abduction. Okay, you move your finger away from the middle finger. This is called as abduction. You move your fingers away from the middle finger. This is called as an abduction. So if I move my little finger away from the middle finger, this is called as abduction of the little finger. So this abduction of the little finger is produced by abductor digiti minimi. If I want to flex my little finger, at the metacarpophalangeal joint, flexor digiti minimi will help. Opponens digiti minimi, you all know, this is the opposition. So these are the actions of the hypothenar group. Don't worry about much about the hypothenar group. We'll go to the next important group, that is lumbricals. As you all know, there are 4 lumbricals. If you divide the 4 lumbricals into the medial 2 and lateral 2, okay, so there are medial 2 lumbricals and there are lateral 2 lumbricals. Okay, so these medial 2 lumbricals and lateral 2 lumbricals we can understand by a simple diagram, or I will show a simple picture for that. Before that, we will see what is in the lateral lumbricals. They are all unipinnate muscle. And they are all bipinnate. These 2 lumbricals are bipinnate muscle. Okay, so we'll just see a simple diagram here, guys. So there are 4 tendons which goes to the medial 4 fingers. And these tendons are called as flexor digitorum profundus tendon. Let us consider the medial side. This is considered the lateral side. So we are talking about the lumbricals. Okay, So the lumbricals are grouped into 2, medial 2 lumbricals and lateral 2 lumbricals. And the medial 2 lumbricals are bipinnate and the lateral 2 lumbricals are unipinnate. Isn't it or not? Yes. So what is an unipinnate? If it arises only from one side of a tendon, it is called as an unipinnate muscle. So these are all unipinnate. Yes. So this lateral 2 lumbricals are unipinnate, whereas the medial 2 lumbricals, are bipinnate muscles. These are bipinnate muscles. Okay, so these are what? These are all bipinnate muscles. Fine. So these are all bipinnate muscles. Okay, guys, so this is very, very important. Lumbricals is very, very important muscle. So lateral 2 lumbricals are unipinnate and medial 2 lumbricals are bipinnate muscles. And what is the action of lumbricals? As I already told you, you keep your hand like this, you draw a letter L. That is the action of the lumbricals. That finishes the action of the lumbricals. So it causes flexion at the metacarpophalangeal joint and it causes extension at the interphalangeal joint. Okay, so that is the action of the lumbricals. Now you are going to tell me the nerve supply for the lumbricals. What is the nerve supply for the first and the second lumbricals? Anybody? What is the nerve supply for the first and second lumbricals? Yes, guys, anybody? So what is the nerve supply for the first and second lumbricals? It is very, very easy. We have discussed in the last session. Yes, very good, guys. So it is the median nerve. Very good, guys. It is the median nerve. Okay. So similarly, the medial 2 lumbricals. The medial 2 lumbricals are supplied by deep branch of ulnar nerve. Deep branch of ulnar nerve supplies the medial 2 lumbricals. Okay. So the lateral 2 lumbricals are supplied by the median nerve and the medial 2 lumbricals are supplied by deep branch of ulnar nerve. Now what is the function? Yes, this is the function of the ulnar. You keep your hand like this. This is the function of the ulnar. Flexion at the metacarpophalangeal joint and extension at the interphalangeal joint is the action of the lumbricals. Now I will ask you one more simple question. Anybody will see, anybody is answering. Who is the first person to answer? Lumbricals are called as proximal wing tendon or distal wing tendon. Yes, anybody? Lumbricals are called as what? They are called as wing tendons, but what is it? Whether it is proximal wing tendon or distal wing tendon. Who is the first one to answer? Yes, guys. Yes, very good, Priya. It is the distal wing tendon. Lumbricals are the distal wing tendon. They get inserted. So this is the origin. Okay, this is the origin. they get inserted into the dorsal digital expansion, guys. They get inserted into the dorsal digital expansion. Very good, guys. They get inserted into the dorsal digital expansion. So this is about the lumbricals. We next go to the next group of muscle, that is the palmar interossei. See, there is a little bit of controversy in palmar interossei. Certain books says there are 3 palmar interossei and certain books says there are 4 palmar interossei. So most of them refer only to 3 palmar interossei. Okay, before going into the palmar interossei, few important things about palmar interossei. They are all unipinnate muscle. They are all unipinnate muscle. So don't worry about it. There is no bipinnate here. There is only unipinnate. They are all unipinnate muscles, and all these muscles will cause only one action. They cause adduction of the fingers. They cause adduction of the fingers. They cause adduction of the fingers. Okay, they cause adduction of the fingers. Okay, so what is called as an adduction? So if you keep my fingers like this, all my fingers are now in abduction. All my fingers are now in abduction. If I move my fingers towards the middle finger, if I move my fingers towards the middle finger, this is called as adduction, guys. This is called as adduction. Okay, so the adduction of the fingers are produced by palmar interossei. So you can keep a simple mnemonic as PAD. PAD. AD stands for adduction, P stands for palmar interossei, P stands for palmar interossei, and all these are unipinnate muscles, whereas dorsal interossei are 4 in number and they are all bipinnate muscle, guys. They are all bipinnate muscles. They are all bipinnate muscles and they helps in abduction. They helps in abduction of the fingers. Guys, please remember. For the little finger, already there is an abductor. Where is the abductor? You get abductor digiti minima here. So for the little finger, there is an abductor. So there is no need for a separate abductor for the little finger. For the thumb also you got an abductor, that is abductor pollicis brevis. So for the thumb also you got an abductor. So there is no need for a separate abductor here. So other fingers requires abductors, isn't it or not? Okay. So in this, the middle finger is the one which can move on either side. It can move on either side. Okay, it can move on either side, and either side it is called as an abduction. Okay, so it requires 2 dorsal interossei to pull it on either side. So middle finger receives 2 dorsal interossei insertion. So please remember this, middle finger receives 2 dorsal interossei insertion. Okay, so bipinnate muscle, it is an abductor. So you can keep this mnemonic as DAB. Dorsal interossei, AB is abduction. AB is abduction. So dorsal interossei, AB is abduction. AB is abduction. AB is abduction. Okay, so please remember this, guys. DAB, DAB, dorsal interossei for abduction. All these are what? Bipinnate muscle. And the middle finger receives how many dorsal interossei? It receives 2 dorsal interossei. It receives 2 dorsal interossei on either side. And also remember, palmar interossei, for the middle finger there is no palmar interossei. So please remember, no palmar interossei for middle finger. Whereas there are 2 dorsal interossei. There are 2 dorsal interossei for the middle finger here. There are 2 dorsal interossei for the middle finger here. Now what is their action? Yes, one is adduction, another one is abduction. Okay, so this is about the various muscles in this. Now if you take all these muscles, okay, the thenar group, the first 3 muscles, and the lumbricals lateral 2 are supplied by the median nerve. All the other muscles are supplied by what? Supplied by ulnar nerve. So please remember, most of the muscles of the palm are supplied by ulnar nerve. Ulnar nerve supplies the intrinsic muscles of the hand. So it is helping in fine movements of the hand. That is why ulnar nerve is also called as, what? It is also called as, yes guys, ulnar nerve is also called as, you hope you know that what is the other name for ulnar nerve. Yes, it is also called as, Swati, very good, it is called as musician nerve. And the median nerve is also called as what? Yes guys, what is the other name for median nerve? Median nerve is also called as the laborer's nerve. Is also called as the laborer's nerve. Yes, ulnar nerve is also called as musician nerve. It is also called as the musician nerve. Very good, guys. So in the hand, it supplies almost all the muscles except 3 thenar muscles and 2 lumbricals, the lateral 2 lumbricals. Okay, so I'll just show you a simple pictures to enlighten you. And before that, we'll just finish up the sensory part also. Yes, so sensory part, the ulnar nerve supplies the medial 1½ fingers. The medial 1½ fingers are supplied by the ulna nerve. Okay, medial 1.5 fingers are supplied by ulna nerve for the sensory part. Okay, so we are clear with this. So we are done with the ulna nerve. We know what are the muscles, we know what are the actions, and we know what are the nerve supply for these muscles. Okay, with this background we'll just see this pictures. Okay, so what is this muscle? What you see here, the muscle what you see here, which has got two heads again, so that is going to the medial side of the thumb, is called as the adductor pollicis muscle, is called as the adductor pollicis muscle. So what is this muscle? This is adductor pollicis muscle. Adductor pollicis muscle is supplied by deep branch of ulna nerve, is supplied by deep branch of ulna nerve, though it is present on the thumb side, though it is present on the thenar region, it is supplied by deep branch of ulna nerve, it is supplied by deep branch of ulna nerve, and all the muscles in the hypothenar region are supplied by the ulnar nerve again, or supplied by the ulnar nerve again. Okay, or supplied by the ulnar nerve. And if you see here, what is this muscle? Yes, anybody? We have discussed about this muscle. This is how questions comes nowadays in exams. They'll give you a picture, they'll put arrow marks, and they'll ask you what is this muscle. Now, can anybody identify this muscle? Can anybody identify what is the muscle we are seeing now? We have discussed about this muscle yes, very good, Swati, very good, Moga, Shita, everyone, you are doing great, guys. So these are called as the lumbricals. These are the tendons called as flexor digitorum profundus tendons. The first two are the unipinnate lumbricals, the next two are the bipinnate lumbricals. Okay, and these two lumbricals are supplied by median nerve, and these two lumbricals are the one which is supplied by ulnar nerve, is supplied by the ulnar nerve. So this is lumbricals. And anybody can tell this muscle, what is this muscle represents? These muscles, they are unipinnate muscle, guys. They are unipinnate muscles. They all drew the fingers towards the middle finger, so they cause adduction, guys. So it is unipinnate, guys. So it is palmar interosseous. So this is how you identify the muscle. In the exam, if they give you an example like this, by seeing the fiber arrangement and how they act, you can easily identify this muscle. This is palmaris interosseous. This is palmar interosseous. And what is this muscle? You can see the middle finger receiving two interossei. So they are moving the fingers away from the middle finger. They are nothing but the dorsal interossei, guys. They are nothing but the dorsal interossei. Okay, so please keep this in mind. Also note here, the first dorsal interossei is pierced by radial artery. The first dorsal interossei here is pierced by radial artery. Dorsal interossei, action is dab abduction. Action is dab abduction. Okay, so dorsal interossei is the most posterior muscle, guys. So first you have to remove the flexor digitorum superficialis tendon. Next you will have flexor digitorum profundus tendon with the lumbricals muscle attached to it. When you reflect the lumbricals muscle, you will see the palmar interossei, the last muscle in the palm. When you go from here, the last muscle in the palm to encounter is the dorsal interossei, dorsal most muscle, dorsal interossei. They are all bipinnate muscle. That is very important. The action is abduction, guys. Okay, so all these muscles are supplied by yes, ulnar nerve. Okay, now so you know the ulnar nerve supplies and you know the action of the ulnar nerve. If the ulnar nerve has got injury, or if ulnar nerve has got injured, what happens to the fingers? Okay, so you all know that whenever there is an ulnar nerve injury, the hypothenar muscle goes in for wasting. So ulnar nerve lesion causes hypothenar wasting. Okay, it goes in for hypothenar wasting. Now when the ulnar nerve is not working, the lumbricals, okay, the lumbricals will not work properly. Okay, so lumbricals action is this. So the lumbricals is not working. So lumbricals for the medial two fingers are by ulnar nerve. So that results in a claw hand like this. This claw hand is called as what? This is called as the ulnar claw hand. This is called as ulnar claw hand. So lumbricals, when it not works, it results in ulnar claw hand. Okay, it results in ulnar claw hand. The next muscle which is not working here is the palmar interossei. As you all know, palmar interossei helps in adduction. Okay, palmar interossei helps in adduction. Now suppose if you give a card to the patient, and ask you to hold between this two fingers, okay, between these two fingers. If you ask him to hold the card and if you try to pull it out, he will not be able to hold it when you can't do adduction of the fingers. So when ulnar nerve is damaged, palmar interosseous will not work, adduction of the fingers will not work, and this test is called as what? This test is called as card test. This test is called as card test. So these tests are named test for palmar the ulnar nerve. So card test is used to check the palmar interosseous, and what they are checking? They are checking the adduction of the fingers. Okay, now you can ask the patient to fan out his fingers. You can ask the patient to fan out his fingers, or you can ask the patient to keep the fingers over the table and lift the middle finger and move on either side. So this test, which checks the dorsal interosseous muscle. So dorsal interosseous muscle causes abduction, isn't it or not? So you ask the patient to fan out his fingers. If the dorsal interosseous is not working, he will not be able to do this, and this test is called as Igawa's test. This test is called as what? This test is called as Igawa's test. Very, very important. All these tests are very, very important. Card test, Igawa's test, ulnar claw hand are all the signs of ulnar nerve injury. All are signs of ulnar nerve injury. Next is an important muscle in the adductor or in the thenar region, that is the adductor pollicis muscle. That is adductor pollicis muscle. Now how do you check adductor pollicis muscle? So let us consider there is a book here. Okay, so there is a book here. Okay, you give the book to the patient. You ask him to hold between the palm and the thumb. So what is this action, guys? This action is called as adduction. So you ask him to hold between the palm and the thumb. So you ask the patient to adduct the thumb and hold it. Okay, and you try to pull it out. Okay, you try to pull it out. If his adductor pollicis is working, you will be able to hold the book normally. But if the adductor pollicis is not working, what he will do is, okay, just see my finger. What he will do is, you will try to flex the finger. Okay, you will try to flex the finger and will try to hold the book. Okay, so when the adductor pollicis is not working, you will try to flex the finger, you will try to flex the thumb. Can anybody tell me what is the muscle that is responsible for flexion of the thumb, or what is the muscle that is responsible for interphalangeal joint flexion? Very good Muga. It is flexor pollicis longus. It is flexor pollicis longus. So if the patient is not able to adduct, okay, if the patient is not able to adduct his thumb, you will try to flex his thumb and try to hold the book, isn't it or not? So the flexion is caused by flexor pollicis longus. And what is the nerve supply for it? Very good Prithviraj, very good. So the anterior interosseous nerve is the nerve which supplies flexor pollicis longus, and we are checking the ulnar nerve. So the patient will do a false action by flexing the thumb and will try to hold. This test is called as book test. This test is called as book test. So you give a book and test. So this is called as book test, and if he flexes his thumb and hold, then that sign is called as Frohman's sign. Then that sign is called as what? That sign is called as Frohman's sign. Then sign is called as Frohman's sign. These are the ways to check the ulnar nerve. These are the ways to check the ulnar nerve. Okay, guys. So now one more important thing is the sensory part. So sensory part is the ulnar nerve supplies the medial 1.5 fingers. So on the palmar side and on the dorsal side, the ulnar nerve, when it not working, it will have paresthesia or anesthesia in this region. So medial 1.5 fingers both on the palmar side and on the dorsal side, there will be decrease in sensation. Okay, so whenever there is an ulnar nerve, so you will have the ulnar claw hand. What you see here is the ulnar claw hand. Okay, and next is what you see here is the Frohman's sign. Okay, so they are asking you what is the muscle you are checking. You are checking the adductor pollicis muscle. You are checking the adductor pollicis muscle. You are checking the adductor pollicis muscle. And what is the nerve you are checking? You are checking the ulnar nerve. You are checking the ulnar nerve. And what is Frohman's sign? We have seen about the Frohman's sign. It is due to the action of flexor pollicis longus muscle. It is due to the action of flexor pollicis longus muscle. Okay, so this is about the ulnar nerve. Okay, last but not the least about ulnar nerve. See, one thing is called as an ulnar paradox. So you should know what is called as an ulnar paradox. Okay, ulnar paradox. See, normally whenever there is an nerve injury, higher up the nerve injury, more severe is the deformity. Okay, see, for example, if the radial nerve is injured in the axillary region, we saw that the elbow goes in for flexion, the wrist goes in for wrist drop, and the finger and the thumb goes in for finger and thumb drop. So whenever there is a lesion at a higher level, the deformities at the distal part will be more pronounced. Okay, but this is not so in the case of ulnar nerve. Higher the ulnar nerve lesion, less is the deformity. And what is the deformity we are seeing in the ulnar nerve? So higher the ulnar nerve, higher the ulnar nerve lesion, higher the ulnar nerve lesion, less is the claw hand, less is the claw hand, less is the claw hand. Okay guys, okay, can you able to follow me guys? Yes, okay, can you able to understand what is called as an ulnar paradox? So normally higher the nerve lesion, more severe is the deformity, but for the ulnar nerve alone, higher the nerve lesion, less is the deformity or less is the claw hand, and this is called as what? This is called as ulnar paradox. This is called as ulnar paradox. Now you are going to tell me how this ulnar paradox had come, what is the cause for this ulnar paradox. Now if you want to understand ulnar paradox, you should understand this picture now. You should understand this picture. Now what is this picture represents? This picture represents a clawing of the fingers. This picture represents a clawing of the fingers, isn't it or not? In clawing, what is happening? Can you able to see? You can able to see the metacarpophalangeal joint is in extension and the proximal and the distal interphalangeal joint are in flexion. Okay, so you can see the proximal and the distal interphalangeal joints are in flexion. Why? Because of the unopposed flexor digitorum muscles. Flexor digitorum profundus muscle, medial half is supplied by flexor digitorum profundus muscle, medial half is supplied by anybody? Flexor digitorum profundus medial half is supplied by? Yes guys, flexor digitorum profundus medial half is supplied by? You all know the answer, it is the D branch of ulnar nerve. What is the function of flexor digitorum profundus? To cause flexion of the distal interphalangeal joint. So when there is a claw hand, the flexion is caused by the unopposed flexor digitorum muscles. Now when the ulnar nerve is injured above the elbow, this flexor digitorum profundus will not work. Okay, will not work. So there will be less clawing in the hand, there will be less clawing in the hand. Okay, if the ulnar nerve is injured here in the wrist, the flexor digitorum profundus will work, so there will be more flexion, there will be increased clawing. So that is why they say whenever there is a lesion of the ulnar nerve in the proximal part, less is the claw hand. So higher the lesion, less is the deformity. So this is called as the ulnar paradox. I hope you would have think about the ulnar paradox. So what is mean by ulnar paradox is normally higher the nerve lesion, more is the deformity, but in the case of ulnar nerve, higher the nerve lesion, less is the deformity, and I have told you the reason for it. See, to get a claw hand, okay, if you want to get a claw hand, okay, so the interphalangeal joints are going in for flexion, isn't it or not? This interphalangeal joint flexion is produced by two muscles. Proximal interphalangeal joint flexion is produced by flexor digitorum superficialis. Distal interphalangeal joint flexion is produced by the flexor digitorum profundus. Okay, when the ulnar nerve is not working, distal interphalangeal joint flexion becomes weak because flexor digitorum profundus is not working. So if you have a lesion of the ulnar nerve at a higher level, flexor digitorum profundus will not work, so you will have less claw hand. But when the lesion is distal, flexor digitorum profundus works, you will have more clawing. This is called as ulnar paradox. Okay, this is called as ulnar paradox. I hope you understood ulnar paradox. If there is any doubt, tomorrow you can let me know. I can again tell you about this ulnar paradox. Okay, so without wasting much of the time, we are going to the next area. Okay, so that is called as the carpal bones. Okay, see, I'll just add one more point, guys. In the nerve lesion, I'll add just last one more point. See, what is this action, guys? This action is called as the abduction, isn't it or not? Abductor pollicis. Abduction of the hand or abductor pollicis is done by, or the nerve which supplies the abductor pollicis brevis is by the median nerve. So if you want to check the median nerve, a simple test like book test, like car test for ulnar nerve, there is a test called as pen test. You keep the pen over the palm of the patient. Okay, you ask the patient to touch the pen with the thumb. So this is called as pen test. So this checks the abductor pollicis brevis muscle. Okay, so for median nerve, One more test you can add along with the ape thumb deformity, along with the Ochsner clasp sign. This is called as pen test, guys. This is called as pen test. Okay, fine. Now coming to the carpal bones. See, you all know that a carpal bone per se are the bones which appear only after birth. So all the carpal bones, okay, all carpal bones, okay, the ossification appears after birth. Okay, appears after birth. Okay, so ossification center for the carpal bones appears after birth. Okay, and after the first carpal bone to appear, is the capitate bone, and the last carpal bone to appear is the pisiform bone. We are going to see all those things. So when you see this carpal bones, you can mark the carpal bone from lateral to medial. So lateral is the thumb, this is the thumb. Okay, so this is the lateral side. So the proximal row of carpal bones are, this one is scaphoid, next one is called as lunate, next one is called as triquetral, and sitting over the triquetral is the pisiform bone. And on the lateral side again you got the trapezium forming the first carpo-metacarpal joint. Next forms the trapezoid. Okay, trapezoid. Next forms the capitate. Next forms the hamate. Okay, next forms the hamate. So these are the carpal bones. Okay, of these carpal bones, the important take-home message is the most common fractured carpal bone is the scaphoid bone. Okay, 2 words about scaphoid, guys. Okay, very important. Okay, scaphoid bone is the one which is most commonly fractured carpal bone. When you see the scaphoid bone, okay, I'm just drawing the scaphoid bone here. The scaphoid bone has got a proximal pole, a distal pole, and a narrowed part called as the waist of the scaphoid. This is called as the waist of the scaphoid. This is the proximal pole, this is the distal pole, and the narrowed part is the waist of the scaphoid. And where scaphoid gets fractured commonly, the scaphoid gets fractured commonly at the waist region, guys. Okay, so if you take the scaphoid, there is an artery which runs close to the scaphoid bone. So this artery is the radial artery. And this artery gives branches to the scaphoid bone. So the radial artery gives branches to the scaphoid bone from the dorsal pole to the, or from the distal pole to the proximal pole. So the blood supply for the scaphoid comes from the distal pole to the proximal pole. Suppose if there is a fracture in this area, in the waist region, now what happens to the proximal pole? The proximal pole will get devoid of blood supply. It goes in for necrosis. This necrosis happens because of the lack of blood supply. So this is called as an avascular necrosis. Okay, this is called as, so avascular necrosis. In avascular necrosis of scaphoid, they will ask you this question: what is the pole which is affected, or what is the part of the scaphoid which is affected, whether it's the proximal pole or the distal pole or it is a waist. So they will ask you, or there is a body. So it is always the proximal pole which most commonly goes in for avascular necrosis. Now I will ask you a question, guys. Okay, what are the other bones in the body which can go in for avascular necrosis? Anybody? The other bones which can go in for avascular necrosis? Talus. Very good, Swati. Other bones that goes in for AVN. Other bones to go in for AVN is talus. Very good, guys. Talus. Okay, then is the head of the femur. Head of the femur goes in for avascular necrosis. Sometimes even the anatomical neck fracture of the humerus, proximal humerus. Anatomical neck fracture of the proximal humerus can also go in for avascular necrosis. Okay, so these are the bones that goes in for avascular necrosis commonly. So please be clear in these bones. Now, most commonly dislocated carpal bone. What is the most commonly dislocated carpal bone? The most commonly dislocated carpal bone is lunate, guys. Okay, fine. So the most common carpal bone, Swati, I think lower 1/3 of tibia, it's not that common, but talus, head of the femur, and the anatomical neck fracture of the humerus are the common bones which goes in for avascular necrosis. Okay, and Yes, what is the most common dislocated carpal bone? The most common dislocated carpal bone is lunate, guys. Is the lunate. Okay. Now there is one more important question related to lunate, guys. There is one more important question related to lunate. So what is called as osteochondritis of lunate called as? Okay, I'll just put a term here. Okay. So what is called as osteochondritis? Osteochondritis of lunate. Very good, Prithvi. Okay, very good, Prithviraj. Okay, the osteochondritis of lunate is called as Kienbock's disease. 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 Osteochondritis per se is a very big topic. There are a lot of things in osteochondritis. Okay, there are a lot of things in osteochondritis. If somebody can answer what is called as the osteochondritis of the tibial tuberosity called as, what is the osteochondritis of tibial tuberosity called as? Anybody? What is called as osteochondritis of tibial tuberosity called as? Yes, I am waiting for the answers. So osteochondritis of tibial tuberosity. Yes, very good, Daphne. Yes, very good, Swati. It is the Osgood-Schlatter disease. It is Osgood-Schlatter disease. It is Osgood-Schlatter disease. Okay, it is Osgood-Schlatter disease. Can anybody tell me what is the osteochondritis of calcaneum called as? Osteochondritis of calcaneum called as? Anybody? Osteochondritis of calcaneum called as? Yes, very good, Dolphin John. It is Sever's disease. It is Sever's disease. Can anybody tell me what is called as the osteochondritis of capitulum called as? Capitulum called as? Osteochondritis of capitulum called as? Anybody? Osteochondritis of capitulum is called as Spanner's disease. Excellent, Dolphin John. What is called as the osteochondritis? Osteochondritis of scaphoid called as? Osteochondritis of scaphoid called as? Anybody? What is called as the osteochondritis of scaphoid called as? Okay, so who is the winner? Yes, it is called as Precious disease. 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 Osteochondritis of scaphoid is called as Precious disease, guys. So there are a lot of osteochondritis. Osteochondritis of femoral head is called as Perthes disease. Osteochondritis of femoral head. Okay, osteochondritis of femoral head is called as Perthes disease. It is called as Perthes disease. Okay, so many osteochondritis are there. So the list is very big. We will discuss anyway during orthopedics. They will discuss all those things. Just to brush up, I am just adding these points here. Now next is, what is the first carpal bone to ossify and what is the largest carpal bone? We have discussed this. The largest carpal bone and the first carpal bone is capitate. Is the capitate, and the last carpal bone to ossify, and this is the smallest carpal bone, and this is the sesamoid bone. Okay, what do you mean by sesamoid bone? It is a bone which arises in the tendon of a muscle. So this bone is pisiform bone. Very good, Jacob. So if it is pisiform bone, if it is a sesamoid bone, we all know what is called as a sesamoid bone. Sesamoid bone arises from a tendon of a muscle. And can anybody tell me what is the tendon that gives rise to pisiform bone? What is the tendon that gives rise to pisiform bone? Yes, anybody? What is the tendon that gives rise to pisiform bone? Yes. So the pisiform bone arises in a tendon called as flexor carpi ulnaris tendon. Very good, Anashwara, Jacob, very good. So it is flexor carpi ulnaris. It is flexor carpi ulnaris. And to add this, there is a largest sesamoid bone in the body. Largest sesamoid bone in the body. Anybody? What is the largest sesamoid bone in the body? Yes, it is very easy question. It is patella. Very good. It is patella. And patella develops in which tendon? Anybody? Okay, patella develops in which tendon? Normally, if you take a sesamoid bone, it develops in a tendon of a muscle. So it develops in quadriceps. That develops in quadriceps tendon. Very good, Swati. Very good, Anashwara. So this is about the carpal bones. Okay, this is about carpal bones. Okay, so important carpal bone is the scaphoid and the lunate bone. Okay, one is going in for fracture more commonly, another is going for dislocation more commonly. See, there is one more entity which I need to add here. So normally the space between the scaphoid, the space between the scaphoid and lunate, is less than 2 mm. Okay, is less than 2 mm. if the space between the scaphoid and the lunate, if it is increased by more than 3 mm, we call this condition as called scapholunate dissociation. We call this condition as scapholunate dissociation. So if the space between the lunate and the scaphoid increases by more than 3 mm, we call this as scapholunate dissociation. Scapholunate dissociation is given by a sign, or there is a sign for scapholunate dissociation. It goes by a famous England actor, is a comedian. That sign is called as Terry Thomas sign. That sign is called as Terry Thomas sign. That sign is called as Terry Thomas sign. Okay guys, so that is an important condition at this junction we need to discuss, that is called a scapholunate dissociation. Increased space more than 3 mm between scaphoid and lunate gives a sign called as Terry Thomas, and he is an actor, a comedian who has got an increased space between his teeth. So they have given this sign called as Terry Thomas sign. This is called as Terry Thomas sign. Okay, now coming to the vessels of the upper limb, or the arteries of the upper limb. Okay, so the first artery what we are going to see here is the axillary artery. Okay, so you all know axillary artery. From where does it extend? Axillary artery. Okay, so this is axillary artery. Axillary artery is a continuation of subclavian artery. Okay, now axillary artery extends from the outer border of first rib. Okay, it extends from the outer border of the first rib to the lower border. It extends from the outer border of first rib to the lower border of the teres major. Okay, to lower border of teres major. Okay guys, clear? And this artery is divided into 3 parts. This axillary artery is divided into 3 parts by muscle here. Okay, I'm just drawing the muscle here in green color. The muscle which is attached to the coracoid process. Okay, getting inserted in the coracoid process, arising from the 3rd, 4th and the 5th rib. So this muscle is nothing but the pectoralis minor muscle. So what is pectoralis minor muscle? It is a muscle in the pectoral region. It arises from the 3rd, 4th and from the 5th rib, goes and gets inserted into the coracoid process, and this divides the entire axillary artery into 3 parts. Okay, so one part is proximal to the pectoralis minor, one part is deep to the pectoralis minor, and the other part is distal to the pectoralis minor. So we can put it like this. So one is called as the first part of the axillary artery, next is called as the second part of the axillary artery, and next is called as the third part of the axillary artery. Now there are several branches which arises from these parts. To understand this or to have a memory of this, we can have a simple mnemonic called as SALSAP. Okay, so from the first part 1 branch arises, from the second part 2 branch arises, and from the third part you got 3 branches. So we call this mnemonic as simple as SALSAP. Okay, so SALSAP. Okay, so first S stands for superior thoracic artery. This is called a superior thoracic artery. The next is called as acromiothoracic artery. The next is called as lateral thoracic artery. This is called as lateral thoracic artery. Okay, this is called as lateral thoracic artery. The S stands for subscapular artery. A stands for anterior circumflex. Humeral artery. P stands for posterior circumflex humeral artery. Okay, so these are the branches of the axillary artery. So from the first part you got 1 branch, that is called a superior thoracic artery. You can see this is a smaller branch which supplies the pectoral region, and it also supplies the mammary gland. From the second part you got the acromiothoracic artery. Okay, so from the second part you got acromiothoracic artery. This acromiothoracic artery, okay, so if you talk about acromiothoracic artery, this acromiothoracic artery pierces clavipectoral fascia. Okay, it pierces clavipectoral fascia and gives rise to 4 branches. Guys. Okay, so it gives rise to 4 branches. You can remember like this: A, P, C, D, A, P, C, D. Okay, so what are the 4 branches are which gives by this mnemonic APCD? A stands for the A stands for the acromion branch or the acromial branch. P stands for the pectoral branch. P stands for the pectoral branch. C stands for the clavicular branch. C stands for the clavicular branch, and D stands for the deltoid branch. It is the deltoid branch. Okay, guys, clear? So acromiothoracic artery pierces the clavipectoral fascia, divides into 4 branches: acromial branch, pectoral branch, clavicular branch, and the deltoid branch. Okay, clear? Okay, fine. So this is about the acromiothoracic artery, and from the second part, running on the lower border of the pectoralis major muscle is the lateral thoracic artery. You can see the lateral thoracic artery running here. Okay, you can see the lateral thoracic artery running here. I'm just erasing the pectoralis minor muscle so that you can have a good visibility of the vessels. So what is this artery which is running along the lower border of the pectoralis major muscle? This is lateral thoracic artery. Okay, now from the third part you got 3 branches. So one branch which is running along the lateral border of the scapula is called as the subscapular artery, and this subscapular artery gives a branch which winds around the lateral border of the scapula. The branch which winds around the lateral border of the scapula is called as the circumflex scapular artery. So subscapular artery gives rise to circumflex scapular artery. Okay, gives rise to circumflex scapular artery. And from the third branch again you got 2 more branches. One is called as the anterior circumflex humeral artery, and another one is called as the posterior circumflex humeral artery. Okay, now there is a question for you guys. We have discussed this in the initial part of our upper limb class. If I talk about posterior circumflex humeral artery, what is the space you see here? Anybody? What is the space you see here when we talk about posterior circumflex humeral vessels? And posterior circumflex humeral vessel passes through which space, or what is the space which is present below the shoulder joint called as? This space is called as what? This space is called as quadrangular space. Very good, guys. Very good. So everybody's are answering very well. So this is called as a quadrangular space, and running along with the posterior circumflex humeral vessel is a nerve accompanying it. Okay, now what is the next question? The next question: what is the nerve that accompanies the posterior circumflex humeral vessel? Yes, guys. Arivumoli, yes. What is that? That is axillary nerve, guys. Yes. Anash, what is that? Yes, it is axillary nerve. Very good, guys. So axillary nerve accompanies the posterior circumflex humeral vessel. I will ask one more question here. What is the branch of axillary nerve that is accompanying posterior circumflex humeral? Very good, Charu. Very good. It is the anterior division of the axillary artery. It is the anterior division of the axillary nerve. Sorry, it is the anterior division of the axillary nerve. So these are the branches of the axillary artery. Okay, and the axillary artery continues as the brachial artery. Okay, so before going into the brachial artery, main important thing to note here is the scapular anastomosis. See, what is called a scapular anastomosis? What is the importance of the scapular anastomosis? See, suppose if the axillary artery has got occluded in the middle part, okay, maybe in the second part or the third part, okay, or in the first part, if it gets occluded here in the first part or second part, so what happens is this anastomosis will help in collateral circulation to the upper limb. Okay, collateral circulation to the upper limb comes from the scapular anastomosis. For that, you should know there is an artery which is running in the neck region, that is the subclavian artery. So what is this artery? This artery is called as subclavian artery. This is called as subclavian artery. This subclavian artery again has got 3 parts in it. From the first part of subclavian artery, there is a branch called as thyrocervical trunk. There is a branch called as thyrocervical trunk. So from the first part of subclavian artery, there is a branch called as thyrocervical trunk. From the thyrocervical trunk, you got 3 branches. One to the thyroid, that is called as inferior thyroid artery. One to the scapula, that is called as the suprascapular artery. one to the neck region, that is a transverse cervical artery. Okay, so fine, from the subscapular artery, so from the subclavian artery, from the first part, from the thyrocervical trunk, one branch goes to the scapular region like this. So this is the deep branch of transverse cervical artery. Deep branch of transverse cervical artery is this one. And there is another branch from the thyrocervical trunk which is going to the suprascapular fossa and to the infrascapular fossa. This artery is called as the suprascapular artery. This is the suprascapular artery. Okay, and if you see on the lateral side, so the subscapular artery is running here, and from the subscapular artery you get an artery called a circumflex scapular artery. So what is this? This is subscapular artery, and from the subscapular artery you get a branch called as circumflex scapular artery, and this circumflex scapular artery passes through the upper triangular space, okay, and this circumflex scapular artery anastomoses with the suprascapular artery, and it anastomoses with the deep branch of the transverse cervical artery. This anastomosis around the scapula is very, very important, because this is an anastomosis between the first part of the subclavian artery and the third part of the subscapular artery. So third part of axillary artery, and the first part of subclavian artery. Okay, and the first part of the subclavian artery are connected by the anastomosis around the scapula. This is very, very important anastomosis. That is why we are dealing with this. So what are the vessels that are participating in it? The vessels which are participating in it, one is the deep branch of transverse cervical artery, Next comes the suprascapular artery. These two are branches of the thyrocervical trunk, which is a branch of the first part of subclavian artery. The third part of axillary artery gives rise to subscapular artery, which forms the circumflex scapular artery. This is from the third part of axillary artery. Okay, so you can see such a good anastomosis occurs between those two. So the anastomosis around the body of scapula is, that is why it is important. Okay, so you got other anastomosis around the inferior angle of scapula found by the dorsal scapular artery, and by the subscapular artery, Okay, dorsal scapular artery and by the subscapular artery, anastomosis takes place at the inferior angle of the scapula, and over the acromion you can have minor anastomosis formed by the thoracoacromial branches. Okay, from the thoracoacromial branch you got an acromion branch that forms an anastomosis around the acromion region. Along with that you will have acromial branch from the suprascapular artery, and you will also have acromial branch from the posterior circumflex humeral artery. This, see guys, this is not that important, guys. The anastomosis around the acromion process and around the inferior angle of scapula is not that important. Just to have an idea, around the acromion process, acromial branch of thoracoacromial artery, which is a second part of the axillary artery, acromial branch of the suprascapular artery, and acromial branch of the posterior circumflex humeral artery gives rise to an anastomosis around the acromion process. This is a minor anastomosis, so don't worry about it. Okay, now coming to the anastomosis around the palm region. Before going into the anastomosis around the palm region, we'll just draw a simple diagram to understand the anastomosis around the elbow region, which is also again important. Okay, see, I'll just draw a simple diagram here. So this is the distal humerus, so lateral epicondyle, capitulum, So this is the trochlea, medial flange of the trochlea. This is the medial epicondyle. This is the medial epicondyle, and you know that there is a bone here. This is the head of the radius, this is the neck of the radius, and this is the shaft of the radius. And you got the ulna bone. I am not drawing the ulna bone here to keep things clear here. Okay, so there is an artery called as brachial artery. Okay, this brachial artery, when it runs into the cubital fossa at the level of neck of the radius, divides into radial artery and ulnar artery. We'll begin with this. So what is this artery called as? This artery is called as the brachial artery. This artery is called as brachial artery, and this brachial artery divides into two branches at the level of the neck of the radius. This is called as radial artery. This is called as a radial artery, and this artery which you see here is called as the ulnar artery. This is called as the ulnar artery. Okay, are you clear with this? This is called as ulnar artery. Now the brachial artery, when it runs in the arm region, it gives a deeper branch which runs through the spiral groove, accompanying a nerve here. Okay, and what is this deep branch called as? This deep branch is called as what? This deep branch is called as profunda brachii artery. This deep branch is called as profunda brachii artery. And what is the nerve that accompanies the profunda brachii artery? Anybody? What is the nerve that accompanies the profunda brachii artery through the spiral groove? This is again an important MCQ. What is the nerve that accompanies? Yes, Monisha, Vinita, very good, Hari. So all these are the important questions, guys. So radial nerve accompanies the profunda brachii artery in the spiral groove. Again an important question. Fracture of the shaft of the humerus. Most common nerve injured is radial nerve. Most common cause for bleeding following fracture shaft of humerus is profunda brachii artery. Okay, so if you see the brachial artery, the brachial artery further gives branches on the medial side. Okay, one branch which runs on the posterior aspect of the arm is superior ulnar collateral artery. This is superior ulnar collateral artery. This is superior ulnar collateral artery. The another branch which runs inferiorly is called the inferior ulnar collateral artery. This is inferior ulnar collateral artery. This is inferior ulnar collateral artery. This is inferior ulnar collateral artery. Okay, so there are two branches here. One is called a superior ulnar collateral artery, another one is inferior ulnar collateral artery, guys. Okay, see, one runs in front of the medial epicondyle and one runs behind the medial epicondyle. So the superior ulnar collateral artery runs behind the medial epicondyle. Okay, fine. So similarly, the profunda brachii artery gives rise to a branch called as the radial collateral artery. So there is a branch called as radial collateral artery which runs in front of the lateral epicondyle, and there is a branch which runs behind the lateral epicondyle, that is called as the middle collateral artery. So what are the two branches on the lateral side which are arising from the profunda brachii artery? Yes, very good, guys. So what is this? This is called as the middle collateral artery, and this branch is called as the radial collateral artery. This is called as the radial collateral artery. So you can see there are number of branches which are arising from above. Okay, on the medial side you have got the superior ulnar collateral artery and the inferior ulnar collateral artery, and on the lateral side you have got the middle collateral artery and the radial collateral artery. Okay, you got several branches here and there. Now what happens to the terminal divisions of the brachial artery? The radial artery gives a branch called as a radial recurrent artery, which anastomoses with the radial collateral artery. So what is this artery called as? This artery is called as a radial recurrent artery. This artery is called as a radial recurrent artery. So radial collateral artery and radial recurrent artery anastomose with one another. Now what happens to the ulnar artery? Ulnar artery gives two branches. One is called as anterior ulnar recurrent and the posterior ulnar recurrent. Okay, so they anastomoses around the medial epicondyle. So what is this? This is called as an anterior ulnar recurrent artery. This is called as anterior ulnar recurrent artery, and this artery is called as a posterior ulnar recurrent artery. And this posterior ulnar recurrent artery and the anterior ulnar recurrent artery anastomose with the inferior ulnar collateral and the superior ulnar collateral artery around the medial epicondyle. Okay, medial epicondyle. So this finishes around the medial epicondyle. Only one remaining, that is the think behind the lateral epicondyle. Now what happens to the ulnar artery? Ulnar artery gives a branch called as common interosseous artery. What is this called as? This is called as common interosseous artery. This common interosseous artery divides into an anterior interosseous artery and a posterior interosseous artery. So this is called as the posterior interosseous artery. This is called as posterior interosseous artery. And from the posterior interosseous artery you get a branch which are running above. Okay, this branch which is arising from the posterior interosseous artery is called as the interosseous, recurrent artery. It is called as the interosseous recurrent artery, which anastomoses with the middle collateral artery, Okay, so guys, so there is a number of anastomosis around the elbow region, which is again an important anastomosis, because as we have seen, when there is a supracondylar humerus fracture, brachial artery can get affected. When brachial artery gets affected, this is the anastomosis which helps in sending blood to the forearm. Okay, so anastomosis takes place in front and behind the medial epicondyle, and in front and behind the lateral epicondyle, and you know the vessels which are anastomosing there, Okay, so I hope this is clear. This is a very simple anastomosis. If you want to understand that, you should draw the diagram and you should read. Okay, because there are a lot of vessels, because lot of MCQs again comes in this. They will ask you posterior interosseous recurrent artery is a branch of, posterior interosseous artery is a branch of, common interosseous artery is a branch of. All these are MCQ questions. Okay, so please be clear in this. Okay, now as you all know that when the ulnar artery and the radial artery, they come to the palm, they form two arches. Okay, so this is the superficial arch which is formed mainly by the ulnar artery. It is formed mainly by the ulnar artery, and the deep arch is mainly formed by the radial artery. Okay, so superficial palmar arch is formed at the level of the outstretched thumb. Okay, it is formed at the level of the outstretched thumb, and the deep arch is formed at the level of the distal palmar crease. It is formed at the level of the distal palmar crease. It is formed at the level of distal. If you see here, you can have a crease here. So this crease is called as the distal palmar crease. So the deep arch is formed at the level of the distal palmar crease. Okay. So if you see the vessels of the palm, okay, or the hand, from the radial artery you get two branches to the thumb. These are called as the princeps pollicis artery. So from the radial artery you get the princeps pollicis artery to the thumb, and from the radial artery you get a artery to the index finger, that is called as the princeps indicis artery. This is called as the princeps indicis artery. Okay, now from the superficial palmar arch you get a proper palmar digital artery, and you get three common palmar digital artery. This three common palmar digital artery supplies the adjacent sides of the fingers like this. Okay, so what are these arteries? So these arteries are, this is called as the proper palmar digital artery. And what are these three arteries? These three arteries are called as the common palmar digital arteries. So if you take the fingers, the three end of fingers are supplied by the superficial arch, which is formed by the ulnar artery, and the lateral one end of fingers is supplied by the branches of the radial artery. It is just opposite to the nerve supply. On the lateral three end of fingers, supply is by median nerve. The medial one end of fingers, the supply is by the ulnar nerve. But when it comes to the artery, the medial three end of fingers is supplied by the ulnar artery predominantly, and the lateral one end of fingers is supplied by the radial artery predominantly. Okay, so this is about the blood supply of the palm. The deep arch, which is completed by the radial artery, they give palmar metacarpal arteries. Which fuses with the common palmar digital artery. So what are these arteries? These are called as the palmar metacarpal arteries. And where do they go? They go and fuse with the common palmar digital arteries. They go and fuse with the common palmar digital arteries. There are small branches. I'm not going into the depth of it. This is more than enough. So you got superficial palmar arch and deep palmar arch. Only main thing is superficial palmar arch is formed by, they will ask you this, superficial palmar arch is formed by the ulnar artery, and the deep palmar arch is formed by, the radial artery, okay. So with this background, we'll go to the next topic, okay. So how you check this arches, how you check the patency of the arch. So how you check? There is a test called as Allen's test. So there is a test called as Allen's test. So using the Allen's test, you can check the persistence of the arch, okay. So you occlude the two vessels and you release only the ulnar vessel. You see whether the limb is getting perfused. So that is called as Allen's test. That is called as an Allen's test, okay. So next is an important topic from the axilla, okay. So the axillary region is an important area where questions frequently comes in the cadaveric images. So they have given a cadaveric images. So before going into the cadaveric images, okay, I just want you to appreciate this picture so that you can appreciate the cadaveric images easily. So when you stand in front like this, okay, what is the structure which is present here? These are the anterior part of the chest, and you get the ribs here, okay. The ribs are forming here, the humerus is here, and you have the scapula behind, okay. So you have got the ribs here, okay, you got the ribs here, you got the humerus on the lateral side, and what you got on the behind is the scapula. I hope you are clear with this. So if I want to draw the cross section of the axilla, I'll draw a simple diagram so that you can easily understand the structures, okay. See, from the posterior aspect of the body, you have this okay, so this is the vertebra, okay. You know that this is the vertebra. So vertebra, it has got a body, it has got transverse process, it has got spinous process. We have drawn all those things. You all know that from the vertebra, from the T1, let us consider this is the T1 vertebra, okay. This is T1 vertebra. From the vertebra, you have the first rib, okay. When the rib comes anteriorly, it fuses with the manubrium sternum or with the sternum, depending upon the level it comes. So it fuses with the manubrium sternum or with the body of the sternum, depending upon the level it is related to, okay. Now if you see the ribs, the posterior aspect of the ribs is closely related to this bone, and this bone is called as the scapula bone. This bone is called as what? This is the scapula bone, okay. So this is called as the scapula bone. So this is called as the scapula. These are the ribs, okay. These are the ribs, okay, fine. These are the ribs. And when you see the lateral aspect of our body, so this is where your shoulder comes. So shoulder joint is mainly formed by the humerus, head of the humerus. So the head of the humerus articulates with the glenoid cavity, okay. So this is the greater tuberosity of the humerus, and this is the lesser tuberosity of the humerus, and this is the intertubercular sulcus. So okay, I'll just come back again. What is this? This is the humerus. This is the head of the humerus. This is the head of the humerus. This is called as the greater tubercle of the humerus, and this is called as the lesser tubercle of the humerus. This is called as the lesser tubercle of the humerus. Now, can anybody tell me what is this area called as between the greater tubercle and the lesser tubercle? What is this area called as? This area is called as the intertubercular sulcus. This is called as the intertubercular sulcus. So what I am drawing is a cross-sectional imaging, okay. So you see the sternum in the front. So this is sternum in the front. You see the ribs on the sides, you see the spine on the back, and you see the scapula just lateral to the spine on the back, and you see the humerus on the lateral side. So this joint which is formed between the head of the humerus and the glenoid cavity is called as the shoulder joint, Now from the sternum and from the body of the sternum, from the manubrium sternum, you get a muscle which is arising. Okay. I'll just draw the muscle with the red color so that you can understand that. So the muscle which arises from the anterior part of the sternum, okay, and from the clavicle and from the body of the sternum, going and getting inserted into the lateral lip of the intertubercular sulcus. Is called as the pectoralis major muscle. So what is this muscle? This muscle is called as pectoralis major muscle. So pectoralis major muscle, it arises, okay, pectoralis major muscle, just I will just write down pectoralis major muscle. About pectoralis major muscle, pectoralis major muscle, pectoralis major muscle, it arises from the clavicle, so it is called as clavicular head. It arises from the sternum, okay, and from the ribs, so it is called as the sternocostal head. So this is called as the clavicular head, this is called as the clavicular head, this is called as the sternocostal head, this is called as the sternocostal head, okay, and it arises from the external oblique aponeurosis. It arises from the aponeurosis, external oblique aponeurosis. This is called as the aponeurotic head. This is called as the aponeurotic head. So it has got 3 heads, okay, pectoralis major has got 3 heads, and this pectoralis major muscle finally goes and gets inserted into the lateral lip of the intertubercular sulcus. Here it is going and getting inside in the lateral lip of intertubercular sulcus, and where this pectoralis major is seen, it is present on the anterior part of the chest. It is present on the anterior part of the chest. Just behind the pectoralis major, you get another muscle here. This muscle is called as the pectoralis minor muscle. So what is this muscle? This muscle which you see behind the pectoralis major is called as the pectoralis minor muscle. This is called as pectoralis minor muscle. Okay guys, clear? So from the anterior part of the chest wall, you see 2 muscles. One is the pectoralis major muscle, another one is the pectoralis minor muscle just behind it. Okay, now you know that from the scapula, okay, so this fossa which you see here is the subscapularis fossa. So you see a fossa here, this is called as a subscapular fossa. So from the subscapular fossa you have a muscle which gets attached to the lesser tubercle, So this fossa which is giving rise to this muscle which is attached to lesser tubercle is called as the subscapularis muscle. So this is called as the subscapularis muscle. This is called as what? Subscapularis muscle. This is called as subscapularis muscle. And you also got a lot of muscles from the back, and main muscle one is latissimus dorsi, which is getting inserted into the intertubercular sulcus, and this muscle is latissimus dorsi. You also know the mnemonic. There is a lady in between 2 majors. One is pectoralis major, another one is the teres major, okay, and you get this latissimus dorsi in between these 2, okay, you get latissimus dorsi in between these 2. Pectoralis major is on the anterior side, latissimus dorsi is on the posterior side, okay. So if you see here, you got the posterior wall, you got the anterior wall, and on the medial side you got the ribs with the muscles attached to it, the muscle which is attached to the ribs on its outer aspect and getting attached to the medial border of the scapula. Medial border of the scapula is nothing but the serratus anterior muscle. So this muscle which is seen arising from the ribs getting inserted into the medial border of the scapula is called as the serratus anterior muscle. This is called as serratus anterior muscle. So this is called as serratus anterior muscle, okay. So now on the lateral part you have the humerus, the intertubercular sulcus of the humerus. So this is an area which is called as axilla. So axilla is an pyramidal shaped area. Axilla is an pyramidal shaped area which is bounded, okay, anteriorly by pectoralis minor and by pectoralis major. It is bounded medially by upper 4 intercostal space plus the upper 4 digitations of serratus anterior muscle, okay, and the posterior wall is formed by the latissimus dorsi muscle and by the subscapularis muscle. The lateral wall is formed by the intertubercular sulcus of the humerus. It is formed by the intertubercular sulcus of the humerus, okay. In the intertubercular sulcus of the humerus there is a muscle or there is a tendon which is running, that also forms a part of the lateral wall, and that structure which is running here is nothing but the long head of biceps, okay. So these are all the boundaries of the axilla. These are all the boundaries of the axilla. So this axilla, if you see, okay, it is like an pyramidal shaped structure, as we have told. So it has got a pyramidal shaped structure like this. This is called as the apex of the axilla, which is called as the cervico-axillary canal, which is called as the cervico-axillary canal, and this is called as the base of the axilla. This is called as the base of the axilla, and this base of the axilla is formed by the axillary fascia. This is formed by the axillary fascia. Okay, fine. So this is about the axilla. Okay, so axilla has got an apex, it has got a base, it has got an anterior wall, posterior wall, medial wall, and lateral. We have seen all this. See, very important is the structure or the contents of the axilla. Okay, contents of the axilla, you all know, guys. So the contents of the axilla are: one, it is axillary artery and its branches, axillary artery and its branches, axillary vein and its tributaries. Okay, then you have got axillary pad of fat. Okay, axillary pad of fat. Then you have got the axillary group of lymph nodes. You got the axillary group of lymph nodes, and you also got the intercosto-brachial nerve, and you also got, apart from intercosto-brachial nerve, you also got the long thoracic nerve. All these are branches, or all these are contents of the axilla. Okay, all these are contents of the axilla. If you see here, this is a cadaveric image. Okay, this is a cadaveric image. I'll try to show you the things what we saw here. Okay, so what you saw here, this one is the ribs. So what is this? This is the rib area. Okay, and what muscle you see here? This muscle, anybody, guys? So this is the anterior aspect of the axilla, and this is the posterior aspect of the axilla. I'll just mark down. Can anybody answer this? What is this muscle which you see on the? Yes, it is pectoralis major muscle. Very good, it is pectoralis major muscle. And what is this muscle now, which is seen on the posterior aspect of pectoralis major? What is this? This muscle is called as pectoralis minor muscle. This is called as pectoralis minor muscle. Now there are certain groups of lymph nodes which are seen in between these. Okay, these are called as interpectoral nodes, also called as, anybody, what are these lymph nodes called as? These lymph nodes are called as Rotter's node. Very good, Anashwara. These are called as Rotter's node. Okay, these are called as Rotter's node. This forms the anterior wall of the axilla. And when you go to the posterior side, okay, so you see a thin bone here. The thin bone is nothing but the body of the scapula. This is the body of the scapula. Okay, now if you, this is the body of the scapula, what is this muscle represents? Okay, what is this muscle represents? This muscle represents a subscapularis muscle. This represents a subscapularis muscle. Okay, this muscle represents a subscapularis muscle. And if this is subscapularis muscle, okay, and this is subscapularis muscle, what is this muscle which is running to the medial border of the scapula, which is here? This is nothing but the serratus anterior muscle. And what you see here is the humerus. Okay, what you see here is the humerus that forms the lateral wall of the axilla, and you can see the contents of the axilla here. This is the axillary artery, and this is the axillary vein, and what is this main thing we didn't touch there? I didn't told there. What is this? Anybody? Which is surrounding the axilla, the artery which is surrounding the axillary artery. Yes, guys, which is surrounding the axillary artery. This is the cords of the brachial plexus. These are the cords of the brachial plexus. So please write down in the contents of the axilla. Very important content is cords of the brachial plexus, or the cords of the brachial plexus. Okay, so these are the cords of the brachial plexus. So this is about the axilla. They can give you a cadaveric image and they can ask you like this. So in this cadaveric image, apart from this topic, I will ask you one more question. What is this muscle represents? Can anybody tell me what is this muscle represents? It is not related to axilla, but if they give a cadaveric image and if they put a mark here, very good. So this is the deltoid. Muscle. Okay, so you all know deltoid muscle is a multipinnate muscle. Okay, it is a multipinnate muscle. Okay, it mainly helps in abduction of the shoulder joint. abduction of the shoulder joint. Very good Muga, and very good Kiki, very good. Okay, so you guys are doing great here. Okay, fine. Coming to the next topic. Okay, so this next topic is, see, I think we have discussed a lot about this. I think there is no need to discuss about the spaces of the scapular region. We have discussed about the quadrangular space, we have discussed about the upper triangular space, and we have discussed about the lower triangular space. Okay, just to have a recap, the quadrangular space is bounded superiorly by, it is bounded superiorly by subscapularis, it is bounded superiorly by subscapularis, it is bounded superiorly by the capsule of the shoulder joint, and it is bounded superiorly by the teres minor muscle, it is bounded superiorly by the teres minor muscle. So these are the superior boundaries of the quadrangular space. Okay, it is bounded on the inferior aspect by teres major muscle. It is bounded on the inferior aspect by the teres major muscle. What you see here is the teres major muscle. It is bounded medially by, the long head of triceps muscle, and it is bounded laterally by, the surgical neck of humerus. Very, very important, guys. It is surgical neck of humerus. Okay, and the content of the quadrangular space, you all know, it is the axillary nerve and the posterior circumflex humeral artery. I don't want to go into this again and again, we have told it several times. Okay, axillary nerve and posterior circumflex humeral artery. Now coming to the upper triangular space, you can see the upper triangular space bounded on superiorly by the teres minor, it is bounded inferiorly by the teres major, and it is bounded laterally by the long head of triceps, not an important space. Sometimes circumflex scapular artery can pass through this space, not an important space, but lower triangular space is important. Okay, lower triangular space is bounded by superiorly by teres major. What you see here is the teres major, medially by the long head of triceps, you can see the long head of triceps here. Okay, and laterally by the shaft of the humerus, okay, laterally by the shaft of the humerus, which is running here, and the nerve runs here. The important nerve that runs in the lower triangular space is the radial nerve, okay, along with profunda brachii artery, okay. So this we have discussed, guys, no need to recap here, we have discussed several times in the previous session. So with this we'll move to the next topic, that is the serratus anterior muscle. Few important muscles. Okay, with that I will try to wind this session. See, serratus anterior muscle, as you all know, it arises from the ribs. It arises from the upper 8 ribs. First 8 ribs gives rise to serratus anterior origin. Insertion is, okay, it gets inserted into the medial border of the scapula. On its ventral aspect. You know the nerve supply for serratus anterior, no doubt in it, you know it very well. It is nerve to serratus anterior, also called as long thoracic nerve. But what is the action of the serratus anterior? So serratus anterior helps in pushing the scapula forward, protraction of the scapula. So action of the serratus anterior is protraction of the scapula. And what is the other important action? Serratus anterior rotates the scapula so that you do overhead abduction. When you lift your shoulder, when you lift your arm above, okay, this is called as overhead abduction of the shoulder. So overhead abduction of the arm is done by the serratus anterior, okay. So if you see the abduction of the shoulder joint, the abduction of the shoulder joint is up to 180 degree, okay. In this 180 degree, 120 degree is contributed by the humerus, is contributed by the humerus. Remaining 60 degree is contributed by the rotation of the scapula. Is contributed by the rotation of the scapula. Is contributed by the rotation of the scapula. So this scapula is being rotated by two muscles. One is called as the serratus anterior muscle, another one is called as the trapezius muscle. So please remember guys, okay, when you lift your shoulder, when you abduct your shoulder, okay, up to 90 degree your deltoid will act. After 90 degree, okay, so the deltoid will not have much function, the scapula starts to rotate, okay. So if you take a total of 180 degree of shoulder abduction, of this 120 degrees contributed by the humerus movement and 60 degrees contributed by the rotation of the scapula, this movement which is happening in the ratio of 1:2, okay, 1:2. So scapula moves by 1 degree and humerus moves by 2 degree. This rhythm is called as scapulohumeral rhythm. This is called as a scapulohumeral rhythm. So what is called a scapulohumeral rhythm? For every after 90 degree, for every 2 degree of movement of the humerus, the scapula rotates by 1 degree. The scapula rotates by 1 degree. So this is called as scapulohumeral rhythm. Okay, so when we talk about serratus anterior, you should know what is called as the scapulohumeral rhythm. Now if the serratus anterior muscle doesn't work, okay, if the serratus anterior muscle doesn't work, the medial border of the scapula cannot be kept close to the chest wall. It becomes prominent when the patient tries to push the wall like this. So this is called as a winging of scapula. So this is called as what? This is called as winging of scapula. This is called as winging of scapula. This is an MCQ. Winging of scapula is produced or caused by lesion of what nerve? It is caused by the lesion of the long thoracic nerve. Long thoracic nerve root values C5, C6 and C7. Okay, long thoracic nerve root values C5, C6 and C7. Okay, so please be clear in that. Okay, so this is about the serratus anterior muscle. So the next muscle is which is seen in this region is the latissimus dorsi muscle. Okay, so this latissimus dorsi muscle is again a very big muscle, okay, which is seen on the dorsal aspect, and it has got a very wide origin. It arises from, okay, it has got a very wide origin. It arises from the iliac crest. Okay, it arises from the posterior layer of the thoracolumbar fascia. It arises from the thoracolumbar fascia. It arises from the T7 to T12 spinous process. T7 to T12 spinous process plus L1 to L5 spinous process, okay, and from the supraspinous ligaments, okay, and from the supraspinous ligament it also arises from the inferior angle of the scapula, okay. Such a wide muscle finally goes and gets inserted into the intertubercular sulcus of the humerus. You know that in the anterior aspect of the humerus there is a sulcus which is called as intertubercular sulcus. This muscle goes and gets inserted into it, okay. So latissimus dorsi is called as a climbing muscle, okay. When you are going to do climbing, latissimus dorsi helps in it. And what is the nerve supply for latissimus dorsi? It is by the thoracodorsal nerve. And also remember guys, thoracodorsal nerve and this latissimus dorsi helps in two main functions. One is called as an adduction of the shoulder joint. It causes adduction of the shoulder joint, and it is also causes the medial rotation of the shoulder. Okay, so this is about the latissimus dorsi muscle. So these are the muscles which are seen in the back of the chest wall, okay. So you see a large muscle here which is stretching across a big area. So this is trapezius, okay. If you take trapezius has got three set of fibers. It has got upper fibers, it has got middle fibers, and it has got lower fibers, okay. So the trapezius is supplied by a nerve called a spinal accessory nerve, okay. This is a cranial nerve, this is called a spinal accessory nerve. This is the 11th cranial nerve which supplies the trapezius. This 11th cranial nerve, which is also called as spinal accessory nerve, supplies one more muscle. Can anybody tell me what is the other muscle which is supplied by the spinal accessory nerve, guys? Yes, anybody in the crowd? Yes. What is the yes, very good, it is sternocleidomastoid. Very good, guys. So along with the trapezius muscle, sternocleidomastoid is also supplied by the spinal accessory nerve, okay. So if you take trapezius, as I already told you, trapezius has got 3 fibers. The upper fibers helps in shrugging of the shoulder. The middle fibers helps in retraction of the scapula. The lower fibers helps in rotation of the scapula. Thereby it helps in overhead abduction. Okay. So trapezius has got 3 set of fibers. The upper fibers helps in shrugging or elevation of the scapula. Middle fibers causes retraction of the scapula, and the lower fibers causes overhead abduction of the scapula. Okay, fine. And when you reflect the trapezium, okay, you can see the next layer of muscles. So this is called as the, okay, so this muscle, what you see here is the longus capitis muscle, okay, and what you see here is the levator scapulae muscle. This is called as the levator scapulae muscle. And what you see here is the rhomboides minor muscle. It is called as rhomboides minor muscle. And what you see here is called as a rhomboides major muscle. Okay. And I hope you know the nerve supply for rhomboides minor and major. It is by the dorsal scapular nerve, which arises from the roots of the brachial plexus. And the muscle, what you see here, put a question mark here. It is very, very simple muscle. Can anybody tell me what is this question mark represents? What is this muscle represents? Yes, guys, which is seen above the spinous process of the scapula in the supraspinous fossa. That is okay, that is called a supraspinatus muscle. This is called as supraspinatus muscle. This is called as the infraspinatus muscle. This is called as infraspinatus muscle. The muscle, what you see here is the teres minor muscle. Okay, these 3 muscles, supraspinatus, infraspinatus, teres minor, along with subscapularis, forms a cuff called as rotator cuff. Very, very important stabilizer of the shoulder joint. Okay, so it forms a rotator cuff. Okay, region. Okay, so these are all the muscles in this region. Okay, these are all the important muscles in this region. And with this we'll move to the last topic of today's upper limb session. So that is clavipectoral fascia. Okay, clavipectoral fascia. See, clavipectoral fascia is a fascia which is present deep to the pectoralis major muscle. You can see the muscle which is being cut here. This is pectoralis major muscle. When you cut open the pectoralis major muscle, deep to it you can see a thin fascia which is called as clavipectoral fascia. It extends from the clavicle above. Okay, it is attached to the clavicle above, and below it is attached to the axillary fascia. Okay, so clavipectoral fascia is attached above to the clavicle, and it is attached below to the axillary fascia, and it encloses 2 muscles. Okay, the muscle which is enclosed by the clavipectoral fascia is one, which is pectoralis minor, and the muscle below the clavicle which is enclosed by it is called as a subclavius muscle. So these are the 2 muscles which are enclosed by the clavipectoral fascia. Okay, so now the part of the clavipectoral fascia between the pectoralis minor and the axillary fascia is called as the suspensory ligament of the axilla. It is called as the suspensory ligament of the axilla. It is because of the pull of this part, the axillary dome is in the form of a dome shape. It is in the form of curve shaped. Okay, so this is called a suspensory ligament of axilla. And the part between the pectoralis minor and the clavicle fascia is pierced by 4 structures. Okay, so what are the structures that are piercing the clavipectoral fascia? Okay, structures piercing clavipectoral fascia is again an important question. It is a short note question. It is an MCQ question for the NEET exams. So one is called as a thoracoacromial artery. Okay, we call it as an thoracic artery or thoracoacromial artery. This is called as thoracoacromial artery. Next, there is a vein called a cephalic vein which pierces the clavicular fascia. Next there is an nerve which pierces the clavicular fascia, that is called as a lateral pectoral nerve. Lateral pectoral nerve. Okay, and last one is the lymphatics from the breast. Okay, so the lymphatics from the breast, okay, pierces the clavicular fascia and reaches the apical lymph nodes and the central lymph nodes of the axilla. Okay, so these are all the structures which pierces the clavicular fascia. Okay, thoracoacromial artery, cephalic vein, lateral pectoral nerve, and the lymphatics from the breast are the important structure that pierces clavicular fascia. I hope I'm clear with this, guys. So clavicular fascia lies deep to a muscle called as pectoralis major muscle. It encloses two muscles, pectoralis minor muscle and subclavius muscle. And you should know about the structures which are piercing the clavicular fascia. Okay, so these are the four structures which are piercing the clavicular fascia. I think I'm clear with this. Okay, so with this we are done with the upper limb session. I think few areas we need to touch. Tomorrow when we start the lower limb, along with the lower limb we'll try to cover it up. Okay, so try to keep revising. So whatever you study, whatever you learn, you try to keep revising and you discuss with your friends, so that will help you a lot in remembering things, and you can achieve well. Okay, so thank you. So we'll see tomorrow.